Schizophrenia is a complex and often misunderstood mental health condition that affects how a person thinks, feels, and behaves. It's not just about seeing things that aren't there or hearing voices, although those can be part of it. Schizophrenia is much deeper and more varied than that, impacting people's lives in profound ways. In this video, we will dive into what schizophrenia really is, what causes it, what the symptoms feel like, how it's diagnosed, and the different ways it can be treated. So, what exactly is schizophrenia? Schizophrenia is classified as a psychotic disorder, which means it involves a disconnection from reality. Unlike conditions like depression or anxiety, which are more about mood and emotional states, schizophrenia primarily affects brain processes and perceptions. People with schizophrenia often experience episodes where they cannot distinguish between what is real and what is not. These episodes are often referred to as psychotic episodes, and they can make it difficult to navigate everyday tasks and maintain relationships. During these episodes, people with schizophrenia can have a range of symptoms. These symptoms often include delusions or false beliefs, hallucinations, which means seeing or hearing things that aren't there, disorganized thinking, and severely impaired functioning in daily life. The term schizophrenia comes from Greek words that mean split mind, but it doesn't refer to split or multiple personalities, which is a common misconception. Instead, it refers to a disruption in the usual balance of emotions and thinking. Schizophrenia affects around 1% of the population worldwide and typically begins in late adolescence or early adulthood, though it can appear at any age. The onset of schizophrenia is usually gradual, with subtle signs appearing over time before more significant symptoms develop. Early signs might include social withdrawal, unusual behavior, or decline in performance at work or school. These early signs are often referred to as the prodromal phase. Causes of schizophrenia. The exact causes of schizophrenia aren't fully understood, but it's thought to be a result of a complex interplay between genetics, brain chemistry, and environmental factors. Genetics play a significant role in the development of schizophrenia. If someone has a family history of the disorder, their risk of developing it is higher. However, genetics alone don't determine whether someone will develop schizophrenia. It's believed that multiple genes are involved, and they may interact with each other in complex ways that we don't yet fully understand. Brain chemistry is another critical factor. Neurotransmitters, which are chemicals that transmit signals between brain cells, are often out of balance in people with schizophrenia. Dopamine, in particular, has been heavily studied in relation to schizophrenia. People with schizophrenia often have an overactive dopamine system, especially in pathways that affect cognition and emotion. This dopamine imbalance is thought to contribute to the hallucinations and delusions seen in schizophrenia. Environmental factors can also trigger schizophrenia in people who are genetically predisposed. If a mother contracts certain infections or experiences severe malnutrition during pregnancy, it can affect the developing brain of the fetus, increasing the risk of schizophrenia later in life. High levels of stress, particularly during childhood or adolescence, can also trigger the onset of schizophrenia in individuals who are genetically predisposed. Additionally, substance abuse, particularly the use of cannabis, has been linked to an increased risk of developing schizophrenia, especially if used during adolescence. Symptoms of schizophrenia. Schizophrenia symptoms can be broadly categorized into positive, negative, and cognitive symptoms. Positive symptoms add to the person's experience. These include delusions, hallucinations, and disorganized thinking or speech. Delusions are firmly held beliefs that are not based in reality. For instance, they can range from paranoid beliefs, such as thinking others are plotting against them, to grandiose beliefs, such as feeling they have special powers or are on a mission to save the world. Hallucinations involve perceiving things that aren't present, such as hearing voices or seeing things that others don't see. These voices can be critical, threatening, or commanding, and they can cause significant anxiety and confusion. Disorganized thinking can make it difficult to communicate effectively, as thoughts may be jumbled or illogical. Negative symptoms take away from the person's experience. These include a lack of motivation, social withdrawal, and a flat affect, which is reduced expression of emotions. People with negative symptoms might find it hard to start or sustain activities, express emotions, or feel pleasure in everyday life. Cognitive symptoms affect memory, attention, and executive function, which is the ability to plan and organize. These symptoms can be subtle, but have a significant impact on the person's ability to function day to day. For example, someone might have trouble following a conversation, remembering things, or making decisions. Living with these symptoms can be incredibly challenging. Imagine not being able to trust your senses or having your thoughts constantly interrupted by voices that others can't hear. This can lead to immense frustration, fear, and isolation. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of schizophrenia. Diagnosing schizophrenia involves a thorough evaluation by a mental health professional. There's no single test for schizophrenia, so the diagnosis is based on a combination of the person's history, symptoms, and sometimes laboratory tests to rule out other conditions. A comprehensive evaluation usually includes a detailed interview about the person's symptoms, medical history, family history, and substance use. The mental health professional will also observe the person's behavior and may use standardized questionnaires or assessment tools to gather more information. To be diagnosed with schizophrenia, the symptoms must persist for at least 6 months, with at least 1 month of active symptoms, such as delusions, hallucinations, or disorganized speech. The symptoms must also significantly impair functioning in work, social relationships, or self-care. Other conditions, such as mood disorders with psychotic features or substance-induced psychosis, must be ruled out. Sometimes brain imaging studies like MRI or CT scans might be used to rule out other neurological conditions, but these tests don't diagnose schizophrenia itself. Blood tests might be done to check for conditions that could mimic or exacerbate symptoms, such as thyroid dysfunction or substance abuse. Treatment for schizophrenia. The treatment for schizophrenia usually involves a combination of medication, psychotherapy, and support services. The goal is to manage symptoms, prevent relapses, and improve quality of life. Medications are often the first line of treatment. Antipsychotic drugs can help reduce the intensity of delusions and hallucinations and improve disorganized thinking. There are 2 main types of antipsychotics: typical or first generation, and atypical or second generation antipsychotics. Atypical antipsychotics are generally preferred because they tend to have fewer side effects. However, finding the right medication and dosage can be a process of trial and error. Side effects can include weight gain, drowsiness, and less commonly, movement disorders. Psychotherapy can be very beneficial for people with schizophrenia. Cognitive behavioral therapy, CBT, can help individuals challenge and change distorted thoughts and behaviors. Psychotherapy can also provide skills for coping with stress and managing symptoms. Family therapy can be helpful too, as it educates family members about the disorder and teaches them how to support their loved one. Support services are also crucial in helping people with schizophrenia lead fulfilling lives. These can include case management, social skills training, vocational rehabilitation, and supported employment programs. Community support programs can provide opportunities for socialization and skill building, which are essential for improving quality of life. In addition to these treatments, lifestyle changes can play a significant role. A healthy diet, regular exercise, and avoiding drugs and alcohol can improve overall well-being. Managing stress is also important, as stress can trigger or worsen symptoms. Mindfulness techniques and relaxation exercises can be helpful in this regard. It's worth noting that treatment plans should be tailored to the individual's needs. What works for one person might not work for another, and it's important to be flexible and patient when managing this condition. At the end, living with schizophrenia requires ongoing management and support, but many people with the disorder lead productive and fulfilling lives. Early intervention and a comprehensive, personalized treatment plan are key to improving outcomes. Now, we want to hear from you. Do you or someone you know have schizophrenia? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.